Good morning, all. Am I audible to all? Good morning. Am I audible to all? Great. Very good morning to all. Again, we are starting our reading club with the prayer.
भेद भाव अपने दिल से साफ कर सके, दोस्तों से भूल हो तो माफ कर सके, झूठ से बचे रहे, सच कदम भरे, खुद को जय करे, हमको मन की शक्ति देना, मुश्किलें पड़े तो हम पर हित न कर्म कर, साथ दे तो धर्म का, चले तो धर्म पर, खुद पे हौसला रहे, बदी से ना डरे, दूसरों की जय से पहले खुद को जय करे, हमको मन की शक्ति देना.
Good morning, all. We are giving tribute to our great master, Dr. Samuel Hahnemann, for his wonderful divine science as a gift to all of us and taught us dare to be wise. We are seeking blessings from our Guru, Dr. Prafull Vijayakar, sirs, who have bridged this divine science with the modern science and made homeopathy easy like mathematics. Jai Hanuman, Jai Homeopathy, Om Vijaykaraya. So, friends, we are in the journey of reading the wisdom of Dr. Samuel Hahnemann from the Organ of Medicines, 6th editions, as well as we are reading the Genetic Materia Medica by Dr. Prafull Vijayakar, sirs. So up till now in organ of medicine, we have covered the theoretical part as well as the practical part. And in the practical part, we have understood the pathogenetic power of the medicines as well as the how to take a symptoms in a particular disease. So in continuations of the one-sided disease, approach to the one-sided disease and the local disease. So we are continuing this aphorism from the local disease. So in local disease, what Master Hahnemann has said that a local disease are of a two variants. That is, one is arising from the internal cause, and one is arising from the injury and external cause. So when there is an injury and external cause, you must sometimes need a mechanical aid to assist them as a body. But when the internal arising of the local diseases, then what to do? So in further continuation of this, aphorism number 189 suggests that and yet, very little reflection will suffice to convince us that no external malady, not occasioned by some important injury from without, can arise, persist, or even grow worse without some internal cause. So that is what very PQRS thing what Master Hammer is telling us that nothing is without the cause. Without the cooperation of the whole organism, which must consequently be in the disease state. It could not make its appearance at all without the consent of the whole of the rest of the health and without the participation of the rest of the whole of the vital force that pervade all other sensitive and irritable parts of the organism. Indeed, it is impossible to conceive its productions without the instrumentality of the whole in its life. So intimately are all the part of the organism connected together to form an indivisible whole in the sensation and function. So this is what Master Hahnemann is also telling about that everything is governed by the genes and gene is the reflection of everything. So this is what any external things happen in our body, it is because of the cooperations of the whole organism. Without that operations, it cannot be possible. So in last line, what Master Hahnemann has written that no eruptions on the lip, no whitlow can occur without previous and simultaneous internal ill health. This is what very important to understand. So whenever you have symptoms of the local disease or some of the local affections, say for example, many a time patients come to us with the eczema, warts and everything. So this is what something we find that it is a local disease, but actually it is not the local disease. It is the internal derangement of the health which is reflected outwardly in the form of local disease. So what to do in these cases? So all true medical treatment of this disease on the external part of the body that has occurred from little or no injury from without must therefore be directed against the whole. So this is what very important understanding that whenever there is a local disease of external origin, external appearance, not external origin with, of injury or anything, in that case, you have to direct your treatment against the whole. That means you need to prescribe on the basis of the whole as a constitutional or a totality. Must affect the inhibitions and the cure of the general malady by means of internal remedy. Again, Master Hahnemann is saying that you need to prescribe the internal medicine, not the external medications on the local part. If it is wished that the treatment should be judicious, sure, efficacious, and radical. So that is where whenever you are treating the persons with basic principles, tenets of the applying the tenets of the homeopathy, then you have to apply this method only. That you have to treat this local disease with the internal remedy only. How Master Hahnemann tell about this? Because he said that this is confirmed in a most unambiguous manner many experience which shows in all cases that every powerful internal medicines immediately after its injections causes important changes in the general health of the patient and particularly in the affected external parts of what whenever you prescribe the remedy based on this law, homeopathic law, nature's law, what these medicines can do, medicine immediately after injection, it changes the general state of the patient and particularly the external part. Even in a so-called local disease of the most external part of the body, and the change it produces is the most salutary, being the restoration of the health of the entire body, along with the disappearance of the external affections, without the aid of any external remedy, provided the internal remedy directed toward the whole state was suitably chosen in a homeopathic sense. So this is what very important understanding. So many a time we have experienced that in my mentor cases that I have seen that the case of the psoriasis, of long-standing psoriasis of the 10 years or 5 years or 7 years durations, and by just prescribing a single dose of a right medicines without any aid of the external applications or anything, within 1 or 2 months, the whole eruptions from head to foot, according to Herring's law, has been reduced as well as the general state of the health is improved. So this is what if it is chosen based on the homeopathy, that means the GCS, then and then it can be possible. That is what Master Hanuman has. And also he has confirmed by many experience. That's why he said about that you have to do like this. This is best effected when in the investigation of the case of the disease, along with the exact character of the local affections and all changes, sufferings, and the symptoms observable in the patient's health, and which may have been previously noticed when no medicine has been used, are taken in conjunction to form a complete picture of the disease before searching amongst the medicine, whose peculiar pathogenetic effects are known for a remedy corresponding to the totality of the symptoms so that the selection may be truly important. So this is what very important to effect this type of the cure. What to do in that case, you have to understand the man as a whole and also to understand the exact character of the local affection of the changes. So if you understand the exact character of the local affection and the changes and the sufferings of that symptoms observable in the patient health, and you combine both and form a complete picture and prescribe, then and then you will get the result. So to give idea about this, I had one case in, so I will show that case in this slide also. In after this finishing of the organ aphorism. So by means of these medicines, that employed internally, that means oral dosage internally, and if the disease be but of a recent origin, often by very first dose. So if the disease of the recent origin, often by very first dose of it, the general morbid state of the body is removed along with the local affection. So many a time you have experienced that many homeopaths has given a dose of puja and everything for the parts. But sometimes the patient comes to you and you have prescribed the constitutional remedy like simple calcarea carb or lycopodium or sometimes sulfur or sometimes another remedy, and within 3 days or 5 days and within 15 days the patient came back to you with the complaint that sir all my warts have been fallen off. So that is something that the recent origin or the first dose of something, the PQRS medicines or a GCS which given, and it removed the morbid state, general morbid state as well as the local affections, and later is cured at the same time as the former. So both are cured simultaneously. So proving that the local affections dependable solely on the disease of the rest of the body. So this is what something what Master Hahnemann is telling, that local disease also local affection is based on the whole of the body. and should only be regarded as an inseparable part of the whole, as one of the most considerable and striking symptoms of the whole of the disease. So this is what something, it is not the particular part is affected, it is the whole organism affected, but the particular part is the seat of actions of that particular individual or a sensitive organ. So this is what Master Hanuman is telling us. I will share with you one of the case which I will show you that how the local affections. Many a time you have the screen is visible to all of you. The screen is visible to all of you. No, I will share another slide so that now it is visible. A case of bacterial infections. Okay, fine, great. So this was many a time you have why I am sharing this case, because this case is giving me some idea that whenever I am treating a case with a constitutional remedy and you didn't get the result, but after understanding the characteristic of that local affection, and then you find that you prescribe the remedy, and that remedy covers the whole and treats the man as a whole. So this is what the case is. A case of chronic eczema on the fingers and the palms. And after that chronic eczema, since 4 days, she had some eruptions, and that eruption goes into infections. And after that, she came to me. She came to me for the chronic eczema, so I had prescribed many remedies like natramur and calcarea sulf, but did not get relief. But after that, she developed some infections, and she came to me with that infection. So that was the infection since the 4 days, and the post discharging and the stick discharge, no itching. Patient was chilly, and this is a short case, it's a long case, but I have just given idea by the observing what to prescribe and what not to, so that so then I observe the lesion, specifically the local affections, and I understand the characteristic features of that lesion. And then I prescribe a dose for 3 days, and within 15 days, everything was normal. Even her eczema of a long-standing duration has been cured. So many a time you have same experience in your clinical practice also, that sometimes you find that in a chronic cases you are treating the chronic cases for a long time, and suddenly one fine day you find some acute disease comes to that patient, and that acute disease gives you some PQRS symptom, and you prescribe the remedy. Say, for example, a class of the antisoric or a chronic remedy or a folic rest remedy on the basis of that PQRS acute disease. And surprisingly, you will find that whole chronic malady also yield to the single dose of that acute remedy. So sometimes you will find this. So I had prescribed netramir and calcarea, but patient cannot relieve. So this was the picture of the patient, that is the eruptions with the eczema. There is the pus and the bacterial infection, and this type of eruption is there. And this was the yellow spot you can see on that index finger. This was something that this was like a crust is removed with the plucker, so that beneath that it was the pus is there. So this is my observations. So this is a bad type of this. Both hand have these eruptions, and this was the very bacterial, very uh, acute conditions and inflammatory conditions with the bacterial infection. So this lady came to me with on the August 15th. So on the basis of those observations, what you think in these cases? This is the local affections, but you have to understand the local affections with the PQRS of that particular symptom. So I understood this on the basis of observations that it is something that the eruptions which ulcerates and form a thick scab under the purulent matter exudes. So this is the PQRS symptoms of the mesarium, which is found in the boic materia medica. So this was my clinical observation. And after prescribing that, within the 15 days, uh, whole eruptions and eczema also regressing to a normalcy. So this was the things which I understood, that in local affections, whenever you are treating the medical patients, you have to observe, and the characteristic of the particular lesion also guide you to such an extent so that your remedy can take care of everything. So this is what within 15 days everything was cleared, and after that everything was fine. So this was the case of what we called as case of chronic eczema. So this aphorism helps us that the our understanding of this is, whenever you are understanding the local disease, and the local disease has to be understood in terms of the PQRS, and then you apply the remedy, and then you can get it. So here it is written the exact character of the local affections and the all changes has to be taken into consideration. So this is helping you to understand that this is the remedy, and after prescribing that remedy you will get the result. So this is what Master Hanuman is telling us and teaching us the wisdom that how our medicine works wonderfully in this case. So it was a 203 dose. See, potency selection, sometimes it is a matter of experience, but I have shared everything about the potency and its selections in the question answer session. So you can go to the question answer session on the YouTube, and you will find the answer to the how to select the potency. So in further continuations of the genetic materia medica, so up till now in genetic materia medica, we have covered the understanding of the genes and the genetic expressions at the level of the mind and body. Then we have covered the Baraita group, and then we have covered the Kali groups and the Calcarea groups. Now we are starting with the another group, that is the carbons. So the most important and very neglected group of remedy, but sometimes you find that you have a lot of carbons and carbonates in your practice, and you have prescribed lot many a time. So carbon is one of the most used remedy in our Materia Medica. So the carbons in our Materia Medica, so there are pure carbons like carbovage, carboanimalase, graphites, carbolic acid, carbonium salt, petroleum, granite, marble, creosote, and another carbons in the form of carbonates like ammonium carb, baryta carb, calcarea carb, magnesium carb, natrum carb, strontium carb, etc. So here we will be dealing with the chief carbon remedies like carbovage, graphites, petroleum, creosote, whereas baryta carb, calcarea carb, natrum carb, mec carb, etc. will be dealt in that respective group. So how the carbon represent to you, or the carbon personality represent to you in the practice. So all these have many symptoms in common that shows us that there has to be a certain process prevalent in the genetic code, and which is common to all. So they all show the genetic tendency. See how the carbon shows the genetic tendency of the slowness, laxness, and the hardness. So here very important that slowness is the process, laxness at the level of the tissues, and the hardness at the level of the tissues. This is what two things has to be find out in the laxness as well as hardness. So slowness and laxness in the mind and body may be associated with the reduced elastin synthesis at the level of genetic code, and hardness and indurations may be associated with the excess of the fibrin synthesis at the genetic code. For understanding of the elastin and fibrin, you must need to understand the miasm in depth. So you must refer again the search book of understanding miasm, sense of the miasm, and the psychosis chapter, so that you have idea about the elastin and fibrin as a protein synthesis process which can lead to the laxness, hardness, indurations, etc. To understand the symptoms of the carbon, let us understand the charcoal. So we have also in calcarea, we have understood the chalk. So by understanding the biography of the chalk, we have understood the whole understanding of the calcarea. So to understand the carbon, we have to understand the charcoal. So carbon is a charcoal. The lump of the black charred remains vegetable life is full of carbon. The charcoal is almost obsolete now. The one-time soul energy and the heat provider is almost extinct now. The generations of the today hardly recognize the charcoal, leave aside being unacquainted with its property. All said and done, the incense stick also behave in the similar manner. Let us for the time being imagine the behavior of an incense stick or a charcoal depending on the property of the carbon. So the first property of the carbon is carbon can catch fire. So this fat lump has energy to light up but not go up in the flame easily. When lit, the fire just simmers. If air is blown, the fire can become a livelier or a brighter, but again subside and goes down to its indolent form. This fire is not raging or raving with the flames, but a slow simmering one, and that is what we called as a lingering fire. Whenever you have charcoal burnt or you have incense stick has been burnt, you can find out that this fire is not like a busting busting flames, but it is something that the simmering one, and that is what lingering fire. So by understanding this lingering fire, so the slowness of the lingering of the complaint is therefore and the indications of the carbon concentration. So many a time you find that the complaint started for many years after certain acute disease and it's become slow and lingering complaint continue for a long standing. So in that cases you can think of it is the carbon can be one of the remedy. Another property, this fire almost get extinguished if there is no air or oxygen supply to it. If you cannot blow it, the fire goes down or extinguished gradually. One has seen a coal or incense stick agarbattis in India. We can, if we blow on it for a time being, it becomes brighter and then becomes white. It burns quietly, producing ash, which is not easily shed off. This shows that the slowness and the species of the fall. So, very important whenever you find any disease at the genetic level, which is there is a slowness and the stasis, you can think of it is the carbon. So these are the general indications from general to particular. Our journey is to understand the carbon. So we have seen the wood burning when there is a violent fire in the forest, the wood of the tree burnt, and when the fire settled down, the charred remains of this wood gives us what we call as vegetable charcoal. So the vegetable charcoal comes out of that. There is a violent fire and then it becomes charred and then it is a charcoal. So violent fire gives rise to a slow charcoal. So very important understanding then when there is the persons are having acute violent disease and came back from that violent state and then become slow, then you can think of that this is the carbon is the one of the remedy. So violent fire gives rise to the slow charcoal. Thus, the typical symptoms that identify the carbon is it wants the air in motion. So why charcoal? Because if the oxygenation is there, then the fire is light up. So they want air in motion and wants fan. So we all know the carbohydrate likes the fan. This desire for fan is not because he is hot patient, but because he wants air in the motion. So this is very important understanding in cases of carbon. Another property with so much slowness in the constitutions, it goes without saying that the vitality is very low and the metabolic activity is also very low. Heat is less, coldness predominates, and they need heat more. Thus, the most of the carbons are the chili patient. Another one. The fourth property, this charcoal has another property that was being exploited about 50 years about. The refrigerator came to India in 50s, 1950s. The people did not know how to use them. The stale food or the closed environment created an obnoxious odor inside them. Then what they do, the charcoal was advised by many to kept inside so it could absorb the bad smell from the fridge. This was before the deodorant age. This property of being a good absorbent was utilized in the allopathy by manufacturing drugs for absorbing gastric flatulence. So there is one remedy, carbendone, was one such a black charcoal tablet that was used in abundance when I used to practice allopathy. This was the source understanding source word. This shows us that the absorbent, deodorant, and a disinfectant property of the charcoal. So vegetable charcoal, if one imagine is soft and has a property of being an absorbent, thus if water is poured on the charcoal, it will absorb it with ease. This may be the good way to remember that most of the carbons are the thirsty. So carbons are the chilly, carbons are the thirsty, carbons are affected on the right sided, carbons are having air, desire for air in motions. So these qualities or a modality have nothing to do with the doctrine of the signature. It is a method of remembering the most carbons are the slow, thirsty, chilly, and crave for the air and oxygen. So these are the one-liners for the carbons. And if you find that the pathology is a slow, patient is chilly and thirsty and desire for the craving for the air and oxygen in the motions, you can think it can be a carbon. So therefore, the carbon constitutions are the timid, predominantly the right-sided, anxious, and the money-minded, with a very slow development of the disease. So most of the right-sided remedies are the money-minded, but the carbons are so much so timid because it simmers. So there is no flame busting. So this is what the timidity is. Apprehensions and anxiousness is there. Everything in this constitution is slow and simmering. There is stasis. Stasis is the key word, and there is a stasis in the cardiovascular system. Stasis in the gastrointestinal system. Stasis in the mind and the body, implying the predominance of the process of the hypopsychosis at the genetic level. So this is what you have to understand, that there is a stasis. So in complete repertory, when we see the rubric talk in this post, we find that there is a 268 remedies. This literally means 268 types of personality or the constitution do not like to talk much. These many constitutions are introverted, reserved, and do not express themselves easily for various reasons. So let us have examined the reason why the persons do not talk or persons to remain very quiet. So either the person can be haughty or egoistic, either the person can be timid, either the intellectual deficient or inability to converse with the others, either the person can be sad, melancholic, and in temperament. That's why they do not want to talk or remain quiet. Either the person get very angry, either the person's temperament who late being disturbed and like tranquility, the people who lack confidence in themselves despite having intellectual ability, then also they do not speak. People who get embarrassed easily, then also they do not speak. And people who are weak in mind and body and cannot tolerate slightest mental or physical exertions. So this can lead to talking disposed to, or people who are ill, etc., are lead to this. So here in carbon, the carbon belong to one kind of the talking disposed to or introverted remedy. But here the carbon belongs to the timid type. Most of them are too timid to express themselves. Surprisingly, despite being timid and emotional, they are predominantly right-sided. Very important, as you have to understand, the right-sided peoples are governed by the left brain dominance, and left brain dominant peoples are of more logical and practical, and they are very, very strong-willed personality. Whereas the left-sided predominantly affected peoples governed by the right brain dominance, and the right brain dominance is associated with the emotions and everything. So very important that the timid personality plus right-sided affections, very important to think of it in the carbon. The right-sided means left brain dominant personality who are stronger mentally than the right brain dominant people. This also means the money-minded people. The carbons are the timid and insecure, just like the calculator. Insecure people require a support for such introverted people who cannot express themselves and frankly ask for the support and security. They seek it in terms of the money. We will find many businessmen who are extremely timid and fearful. They are very, very money minded and like to accumulate it for the futures, and this could often fall in this category of the carbons and calcarean. So, this is the fourth group after the Baraita, Calcarea, Kali to be timid and predominantly right-sided. So, whenever you find a timid and right-sided remedy, you can think of the fourth group of remedy. The barium, Calcarea, Kali, and carbons are the four group which comes to our mind when we see the slow, right-sided, and timid constitution. Whenever the defense mechanism has been changed to the psychosis, the defense of the fortification and proliferations is defense used by these carbons to counter when the first defense of Sora fails. So this means if the psychosis has started, there must be have some acute inflammatory conditions, and that has threatened the patient's life a few years back. So in order to save the patient from going into a destructive inflammatory process, the genetic code switches on the defense mechanism of the psychosis and the stasis. Thus, the slowness, thickening, growth, induration, tumor, hardness are also signs that tells us that this person has once upon a time suffered from a major life-threatening illness which should be undoubtedly proved. So very important understanding is to understand that SORA has to be proved in each and every case. In short, if a disease is slow, neither progressing too fast nor responding to the conventional treatment, our first understanding of the case should be that the psychosis or the fortification process has started at the genetic level. This has to be have started somewhere after the patient suffer from some acute inflammatory illness like the SORA. This SORA was suppressed and psychosis has started. Thus, we get the inkling that either the patient has suffered in the past from the pneumonia, typhoid, malaria, or an episode of the high fever, or any strong inflammatory disease, or a catastrophic, almost life-threatening illness like the intrauterine death of a fetus or an abortion, and has been controlled by antibiotics or maybe specific homeopathic medicine, and the patient has never well since. So whenever the patient has never well since some acute illness, acute violent illness, you can think of that this is the carbon is one of the remedies. This is how we understand the journey of the patient that started with the psoriatic disease and the acute inflammatory disease and ended up in the psychotic disease, the slow fortifications or growth disease. The effect of the various process at the genetic level on the tissue. So how the tissue represent to us when the genetic level the psychosis has been presented. So the first point is the reduced elastin. The process at the genetic level that causes the relaxations of the tissue. So when there is a relaxation, so inelasticity causes relaxation, the relaxation causes slowness and the stasis is seen in every system and the tissue. So this is in the GI system. So we expect the intestine, both the large and the small, misbehaving exactly as in the psychosis persons would. The constipation, the slowness of the digestions, and the slowness of the excretions of the dirt from within automatically explain the offensiveness of the carbon element. The breath will be offensive, the flatus will be offensive, the discharges whichever and wherever they are formed stink. So when we go to the patient's bedside and we just can't stand there because of the offensive order, we need to start thinking about the carbon and especially if and only if the illness is slow in progression. So this is what very important to understand. The liver of the carbon is almost most susceptible organ. So if the person has suffered from the jaundice once or too often or has a tendency to the sluggish liver and difficult digestion with the tendency to offensive gas formations, we should think about a carbon either as an anion or a cation. Stasis in the respiratory system will naturally slow down the oxygenations of the whole system, giving rise to easy fatigue and a characteristic air hunger and the need for the fan. The breath also will be of the cadaverous order. So stasis in the cardiovascular system will be manifested by the portal circulation being slowed down and the vein become inelastic, resulting in long-standing hemorrhoids or the varicose vein. It also leads to the sluggish circulation and hence the intolerance to the cold air. So this is what we have seen that there is a relaxation because of elastin reduce. And if there is a fibrin is excess, then what the genetic process happen at the level of body. So the process at the genetic level with the fibrin excess gives rise to a hardness and the induration. So excess fibrins in the skin gives rise to a cones, callosity, keloids, and the hard and the rough skin of the hand. The excess fibrin in the cardiovascular system causes arteriosclerosis and the thickening of the blood vessels. There is the excess fibrin in the lymphatic causes the hard swelling of the glands. Excess fibrin causes ischemia to the nervous, making them oversensitive, and the different carbon have a different nerve affection. So this is very important. So excess fibrin gives rise to atherosclerosis of the cerebral vessels, which lead to ischemia to the brain, causes lack of nutrition to the brain, thus resulting in forgetfulness, weakness of the memory, and absent-mindedness, etc. So whenever we think of persons never well seen, an acute life-threatening illness is a very strong indication of the carbons, but only when the reactions is slow and lingering. So this is what very important. Weakness, tiredness, and fatigue due to the improper oxygenation of the blood is an outstanding indication that draws our attention to the carbons. Naturally, the stamina of the carbon is bound to be less, and hence they are almost always aggravated in the evening. The easy fatigue can always be better by stimulant, and hence the carbon desire stimulants. Now, what are the entry point of the carbon in the shots? So, up till now, we have understood the aspect of the charcoal and charcoal characteristic gives rise to a certain characteristic of the person. So, entry point. So, whenever we see the patients who have been suffering from the extreme weakness since more than 1 or 2 years, it's a chronic process. When we see the patients who have been suffering from the chronic lack of appetite, indigestion, after an acute attack of the hepatitis 3 or 4 years back, then you can think of it can be a carbon. When we see the patient who has been suffering from the hemorrhoids or the varicose vein for the last 5 years, after suffering from the jaundice year back, you can think of it is a carbon. When we see the patient who has been suffering from the cardiopulmonary disease with the cold perspirations on the slightest exertion, you can think of carbon. When we see the patient who has been suffering from the slow growing tumor in the brain, for example, meningioma, astrocytoma, etc., since 5 years and yet not crippled, then you can think of it can be a carbon. When we see the patient who has been suffering from the chronic acidity or indigestion for the last 10 to 15 years, you can think of carbon. When we see a patient who has been suffering from a long-standing low relapsing fever, not responding to treatment since the last attack of the pneumonia, then also you can think of carbon. When we see patients who has proliferative tendency of carbons in psychosis to produce a large scale warts, cones, callosity, fibroids in the uterus, etc., you can think of carbon. The laxness and the looseness prevailing in every tissue makes the blood vessels loose and their improverness and impermeability, thus resulting in the passive venous bleeding. So any arterial bleed or a profuse bleed from any wound or organ can help us to rule out the carbon. So very important understanding that carbon is also having a passive hemorrhage. So whenever you find any active hemorrhage or active arterial bleeding hemorrhage, rule out carbon. On the other hand, if one notices a slow or a chronic tendency to bleed, one should start think of the carbon. So the hallmark remedy of the carbon group is the carbovage. So from above understanding the property of the charcoals, we get some prominent symptoms of the carbons that lead us to think of carbovage. So the triad of the carbovage is the slow chronic disease after acute major illness, timidity, anticipations, a right-sided thirsty liver and digestive remedy, and at the genetic level, there is a stasis and the oversensitive offensiveness and desire for the fanning and air in motion. So whenever you find this type of the triad in your clinical practice, you can think he might be a carbon remedy. So in clinic, when you think of carbovage, so in clinic, first we can think when there is a never well since some major illness, it's like beginning of the slow, prolonged chronic disease after major illness. For example, violent fire gives rise to slow burning charcoal. So patient says that since I had a jaundice, I have this problem. Since I had a pneumonia, I have this problem. Since I had a COVID, I had this problem. So many a time the carbon patient comes after the COVID. So you can think of the carbons when never well since the major illness. There is a stasis and a slowness and the sluggishness at the genetic level process. Then there is the offensiveness of the all the discharges, the desire fan in motions or air in motions, timid, anticipatory, and right-sided people. So whenever you find this type of the 4 or 5 points, you can think of it is a carbon. Now, major illness whenever well since so the carbovage is ideally seen clearly in psychotic defense. The fatness, slowness, timidity, and the stasis are all psychotic defense at work at the genetic level in carbovage. But this psychotic defense can only occur in the organism as a sequelae if it has been previously exposed to the strong caloric affections in the past. It means the acute inflammations, acute attack of the spasm, acute asthmatic attack, and acute infections, intrauterine death of the fetus, etc. After the recovery of the patient from such prolonged acute distress, the genetic code shifts the defense to the psychosis to slow down the whole organism that has been exposed to the ravage of the acute illnesses, thus resulting into psychosis. The psychosis here in carbovage is the hypopsychosis, means the less synthesis of the elastin. The less elastin synthesis result in the laxness, slowness, and the less elasticity of the muscles, tendon, and blood vessels, etc. When elastin synthesis in the blood vessels and the muscles of the heart become less, there is obvious a slowness of the circulating system. This causes the second prominent symptoms of the carbovage is stasis. Stasis, excessive tiredness and weakness with the profuse perspiration. So again, this is what the indications of the kali cough. When you have a kali cough, sweat, weakness, and debility. So here also there is excessive tiredness, weakness, and profuse perspirations. The perspiration can be cold, clammy, the blood circulation is sluggish, blood stagnated as if blood stasis, the faintness, fainting, general morning rising on, faintness, fainting, general sleep after. Patient look bloated all over with the cold perspirations, cold skin with the bluish or grayish hue indicating the lack of adequate blood circulation to the distant part. Such conditions reflect a poor heart with the lax muscle fiber, leading to the congestive cardiac failure or involvement of the lung in the core pulmonale. So whenever you have a cardiac emergency or a cardiac condition, chronic cardiac conditions after an acute disease, you can think of the carbovage. The faintness after the sleep emphasizes the laxity of the systems after resting. So stasis in the respiratory system causes air or fan desire for, there are need for oxygen and hence the Feeling chilly or cold, they want the fan to be continuously on. This gives a false impression that the patient is hot and wants fan. They need fan as they have air hunger and want air is to be in the motion. So air open desire for air draft ambiguous, air indoor, air ambiguous, fan desire being fan desire to be. Stasis in GI system causes a flatulence and offensiveness. The weak digestion is stressed out if the person eats rich food or a fat. Thus, fats and rich food aggravate. The less of elastin in the intestine muscles makes the intestine sluggish and they do not move. When they don't move, there is a stasis of the food and the lower bowel do not move, causing stasis of the external material. When there is a dirt accumulations in the place, it is bound to stink. Similarly, in carbohydrate stasis resulting in offensive breeze, offensive irritations, and offensive flatness. The patient is sensitive, tender in liver region, short as if too short, liver region, tender tension in liver region. So the actions on the GI system gives rise to a sluggishness of the liver. Constipation difficult, soft stool after constipation, ineffectual urging and straining, order, breathe, general offensive, order, breathe, general putrid. When there is a stasis of the intestine, the patient's dull GI system needs stimulus in the form of acid, salt, and sweet things. So, acid may act as a temporary stimulant to the system, and salt and the carbohydrates help in the acquiring temporary energy and strength for the weakened system. Acting on the blood vessels, so blood vessels affections, there is a laxness of the cardiovascular musculatures, as mentioned before, gives rise to a congestive cardiac failure and looseness of the wall of the blood vessel. The veins and not the arteries are affected by the lack of elastin, giving rise to a large blue hemorrhoids with offensive order. The varicose vein, if the patient has come with the complaint of the hemorrhoids or a varicose vein after he suffered from jaundice few years back, it gives us a lead that he could be a carbo weight. Blood vessels, especially the smaller one, rupture and hence causes a passive bleeding. The difference between the phosphorus and carbo wage is that the phosphorus bleeding is the bright red, profuse, gushy, active bleeding, and the carbo wage is a slow, passive bleeding. So acting on the blood vessel complaints of blood stasis, blood stagnated as if, and blood circulations of the sluggish. Now, the bleeding tendency are also controlled by the genetics and will relate to the type of the blood vessels that are fragile. The active bleeder bleed from the arteries because their arteries are fragile. They have a bright red or a hot blood. These are the phosphorus, belladonna, henomelis, aconite, typica, china, param, lachesis, sabina, sulfur, sulfibers, pastoris, viburnum, opulus, etc. And the passive bleeders are the carbovage, arnica, china, crotalus horridus, lachesis, sulfur, millefolium, pulsatilla, sickle, sepia, sulfuric acid, etc. So these are the few active bleeder and few passive bleeder. Mentally, Mentally, the Carbovich personality, as mentioned earlier, is a timid, quiet constitution. It is a full of anticipation. Though angry, they suppress their anger and do not have the courage to blow it out. Just like a charcoal that has fire within but never actually flares up. So there is a timidity public about appearing, timidity in public, timidity about public appearing to talk and inept to talk. So this is what the carbon is. The timidity keeps the anger within, but through the indirect way, the anger or the discontented is expressed as a form of mocking and sarcasm. So very important understanding is whenever the person comes to you, we are slow, sluggish, right-sided, and always in the mode of mocking and sarcastic way, and timid, you can think of it is a carbon remedy. So carbovage are not very sensitive or emotional people, unlike their graphitis counterparts. They are busier trying to cope up with their bodily weakness, knowing very well that they cannot fight. They swallow their anger only to throw it out in the form of sarcastic remarks. This condition is met with an Indian housewife. A timid, quiet, not so meek girl get married into a male-dominated family. The husband and the father-in-law or even the mother-in-law dictate terms, and all her desires and ambitions are suppressed, like in Stephisagria. But Stephisagria is sensitive. It is sensitive to the rudeness, reprimand, insult, and humiliations, and the anger that is pent up will be either thrown out in the form of a volcano at other people or on her own children, or get transformed into psychotic cyst in the ovary or a fibroid in the uterus, or even weakness of the sphincter and the muscles. But emotional sensitivity and sensitivity in general still remain. The fighting nature will still remain. Not so with carbo waste. It quietly hears everything but throw out a sarcastic remarks just to emphasize that she cannot be taken for granted. Occasionally, there will be a anger which will be followed by the paleness of the face and no redness like the belladonna. If the dominations continue, she become completely indifferent, just like the stasis in the body, and the mind goes into stasis and does not react. She develops indifference to the children, family, loved ones, and relationship, and even to the joy and suffering. So this sometimes you find out this is the same features as the sepia have. She neglects her duties, which she used to do diligently before. She becomes indifferent to music that she used to love before. She becomes sleepy and lazy, obviously due to the lack of oxygenation in the system. The whole situation, both body and mind wise, is that of I want to do something, but my weakness makes me helpless. This is very important understanding. And from this emerges the unfortunate feeling. So I want to do something, but my weakness makes me helpless, and this lead to the unfortunate feeling. So the unfortunate feeling is due to the weakness, and the indifference also is due to the frustration and the weakness. So this is very important. The unfortunate feeling in carbons is due to weakness. Now, remedy comparisons and the differentiation. So, differentiation between the prominent remedy to indifferent of a indifference. So, the other chili remedies that could possibly come close to the indifference, like the sepia, calimure, caliphos, phosphorus, acid phos, and the nitric acid. As we know, the calimure and the caliphos indifference will be the people who are very quite active, fast, reactive, and touchy before they went into such indolence and indifferent state. Phosphorus in the past was very loving, affectionate person who loved company and liked to give love and take love and with desire for magnetism. The combinations of the indifference to the family in a sarcastic looking woman or a man gives us a selections between only three remedies, that is sepia, nitric acid, and carbo waste. So very important, different family plus sarcasm. So all these are the chili, all are the weak and have laxness of the tissue, and all are the trustless. Sepia will be better by the exercise and work with weak body and positive and a strong mind. Carbo waste cannot bear any exertion and is worked by exercise. So whenever you find the indifferent and sarcastic people, you can think of three remedy and you have to rule out by just exercise. Do you exercise and you get the relief from exercise? Straight away think of sepia. Carbo waste does not do exercise or having exertions aggravate. Nitric acid will be better by moving or the traveling with the definite element of the unforgivable grudge, anger, and hatred for those who are responsible for her condition. So this is what very important difference between the nitric acid, sepia, and carbo waste. The difference between the prominent remedy who feel unfortunate. So here the chili remedies like China, sepia, staphylococcus, graphitis, carbo waste, and chelidonium and tabacum, and the hot remedies lycopodium. The feeling unfortunate means either a feeling of unlucky or ill-fated. This is a sad state or a state of disappointment. One get disappointed if something they want does not happen or something they wish they did not get. Every remedy has something that they need or desire that is peculiar to that constitution or a group of constitutions. So, for example, lycopodium. So Lycopodium need is a power in the hand. It feel unfortunate if he thinks that he has lost power or he cannot dictate. When the Lycopodium feels he cannot dominate, there is a feeling of no power to control. This happens especially in old age in people who once upon a time dominated the family or an organization and now they are out of the power and control. This makes them feel unfortunate. So this is what Lycopodium is. They are hot and thirstless. China, what China lack is the physical as well as the mental strength. It is badly need a strength and the courage. The unfortunate feeling here arises due to not being able to do anything due to physical weakness in the syphilitic stage and mental weakness in the soric as well as psychotic stage of the disease. So this is what China is. In Sora, the mental weakness makes the China constitution timid. The timidity of the China prevent it from retaliating against any wrong being done to them. And then they go into a depression in which they feel they are unfortunate. In psychosis, this remedy exhibits the cowardliness and it views on its mental impotency and feel unfortunate. Syphilis or a tendency to destructions in the liver, blood vessels, etc. is the commonest or uppermost defense that this remedy or a constitution aid up. Here, weakness, especially the physical, makes and the prominent patient feel unfortunate. Later, as the destruction increases and he need help from others, this remedy gets conscience pain. Because this remedy has genetically weak liver, it suffers from the liver affection, has a lot of perspirations along with the weakness. All this is found even in carbo which mark oversensitivity and irritability from the noise, light, as well as the smell, distinguishing it from the carbo which that is otherwise almost similar. China has desire for the fruit that Carbovate does not have, though both are chilly. Carbovate desire for fan, which China hates. So they are chilly and thirsty. Sepia, both Carbovate and Sepia in psychosis and syphilis become weak. The Sepia wants to move ahead positively, whereas Carbovate becomes static. The Sepia work hard, relentlessly, not caring for the family or near and dear ones. The Carbovate shows affection to the children. The unfortunate feeling here arises due to the unavoidable circumstances or environmental emotional obstruction or a prolonged grief. The feeling of the sepia is that I could not achieve. It makes her so sour, indifferent, and sarcastic. Sepia will be better by exercise and work with a weak body and a positive and strong mind. Carboways cannot bear any exertions and is worse by the exercise. In psychosis, the defense is by reducing the elastin in the muscles in the both the remedy. In carbovate, the circulatory systems and the cardiac muscles become lax, whereas in sepia, laxness in the ligament that hold the uterus, resulting in prolapse of the uterus. Sepia constitutions are the lean, thin, chilly, and thirstless. Again, the stephysagria. So here the sir has given one of the case. So the case of the hypothyroidism that got cured in a lady can highlight the unfortunate situations of the stephysagria. She was a 53 years old senior most executive in the multinational bank. She was aware of her high status and was always telling about her achievement to everyone. In her history, she told us about how she had learned homeopathy and how she was curing incurable disease with a single dose. I have earned a lot of respect from my staff because I cured a case of the tumor in the breast and saved lakhs of rupees of my fume by avoiding an operation. But she said, though I am respected so much in my office, I find that my husband has no value for me. This is the commonest phenomena of the every woman that they feel that husband has no value for me. He scolded me rudely in front of any relatives that I should work first in the kitchens and then think myself as the doctor. Similarly, my mother and father-in-law do not care for me. I do feel bad. I am hurt, but I cannot say anything because he has a very bad temper. I feel I am unfortunate not to get family who understand me and encourage me. Here there is a desire for dignified status which she has not got in. in spite of being successful. They are bosses in their field and achieve dignity in the office but suffers at home especially because their husbands are dominating. They feel they have learned so much, studied so much and achieved so much, they will tell everyone what they have done to create a good opinion for themselves. So this is what Stephysagria is. Stephysagria is chilly, thirstless, sensitive to rudeness and care for dignity. Another remedy, graphitis. So graphitis is the emotional remedy and the reaction is sad, melancholic, fat, chilly, and thirsty. More in the later chapters of the graphitis. Carbovage, the unfortunate sensation arises out of the weakness like the china, especially the cardiovascular and the gastric weakness. It has affections for the liver and extreme perspirations and desire for salt. It is chilly but wants slow fan in motion. Chelidonium, Chelidonium, it is the conscientious chilly affections of the liver with the desire for the warm drinks is the chelidonium. And the tabacum, the unfortunate sensation is because of instability and imbalances of the whole system. For example, suddenly perspire and suddenly goes cold. So this can lead to the unfortunate feeling in the tabacum. So ruled out point of the carbovage. So carbovage may be ruled out whenever you find that if the patient is very fast, active and has sudden or violent symptoms, rule out carbons. If the headache of the carbovage will be dull, aching and never throbbing headache, this is what carbovage is because it's a slowness in the circulation. So if it is throbbing, then there is a artery is at work. If it is a slowness in circulation, then venous congestion is there. So the congestive and slow dull aching is the carbovage. Red discoloration of the face after anger or any excitement, rule out the carbovage because it is the blood vessels get dilated, artery get dilated, gives rise to plethora. So when there is a plethora, rule out the carbons. No history of the liver problem or a gastric problem, rule out the carbon because fear of actions is most important. Waking up fresh in the morning rule out the carbon or carbons having a slowness and sluggishness. So in morning they become very slow and waking up tired and weak. So whenever the waking up fresh, you can think you can rule out straight away rule out the carbohydrate. If there is a arterial hemorrhage or profuse bleeding, ruled out the carbohydrate. So in short, the obese people having a long-standing illness with the grayish hue, easy sweating, easily tired, wanting faint, mentally timid and anticipatory, right-sided and thirsty are the carbohydrate personality is. This is what very important line of carbohydrate. So we end our sessions here and we will continue graphitis from the tomorrow. So thank you so much for being with me in the morning reading sessions. Thank you all. We conclude the sessions here. Thank you so much.